Hey.
Hello.
How smooth was that?
That was beautiful. That was perfect.
It looks like we've done this before.
Yes, and we're matching.
I love it. I love it. Love it. Excellent. Well, thank you, Dr. Olson, for joining us today. You're the president of Intimate Rose, and I'm so excited to be able to talk about tips for painful penetration.
Yes, thank you so much for having me.
Yes. All right. Well, let's just jump right into it. We have a good list of questions here. Tell me a little bit about what are some of the causes, some common causes for painful penetration?
Yeah, so there's a lot of different ways that somebody may come to the experience of having pain with intercourse. One of them being changes in hormones that can lead to then changes of the actual vaginal tissue itself. So different estrogen states, namely being in a low estrogen state, can lead to some thinning and some just more tenderness of the vaginal wall that can lead to pain with penetration. That can happen after baby, so after delivery, and then in that perimenopausal time frame. And then after menopause, when the estrogen states are perpetually lower. And so another way is through the involuntary or reflexive contraction of the pelvic floor muscles around the vaginal opening, which can lead to difficulty with anything penetrating, whether it's a tampon, a speculum, or a partner. And so when those muscles are providing closure, it can be very, very difficult for something to enter, and it can feel like a train hitting a brick wall, and very, very painful. Likewise, with even women that can have penetration and can have something inside them, they can have the presence of tender points, also called trigger points, within the pelvic floor muscles that are tender themselves, or compression on the nerves through either surgery or restriction of the muscles, those kinds of things. And then certainly the presence of scar tissue. Sorry.
That's so fine. You're
got
human.
caught in my own net.
No, you're human. I'm afraid because I do a lot of hand talking. Although as the person that asks the questions, I don't do as much hand talking because I'm listening more. But I'm always afraid that I'm going to do my hand talking and pull on my headphones.
Yes, because as physical therapists, we demonstrate pelvic floor with the hands, and then I'm Portuguese, so then I do it. We're very similar to Italians.
I love it. I love it. I did not realize you had a Portuguese background. That's so cool. I love different ethnicities.
Very animated people.
Love it. Love it. So that involuntary pelvic floor muscle contraction, we hear the term overactive pelvic floor muscles. So it's kind of the same. There's different words for the same state.
Yes, absolutely. And certainly overactive being the consensus that we want to form as clinicians. So
I know. No, there's such a wide range. Okay, but if somebody had heard overactive, I wanted to make sure they were connecting with that.
Yes.
So how would someone know if their pelvic floor is overactive?
Yes. Well, namely by having an evaluation by a pelvic floor physical therapist or occupational therapist or other rehab professional that's trained in being able to assess that, because there are some other things that could be happening along the way. So that having that thorough evaluation would be, kind of the gold standard of knowing, or by another healthcare provider.
If they didn't have access to a pelvic therapist.
Yes, exactly. They could also know based off of some of those symptoms that we just described, with pain with penetration, inability to have penetration. Those would also be indicators.
And it's not just pain with sex. It could be you can't tolerate a vaginal exam at your annual assessment, or tampon insertion.
Yeah.
You've never been able to use a tampon, or maybe you were at one point and now you can't. There can be some other things there too, right?
Yes. Constipation is another hallmark symptom of overactivity of the pelvic floor. I mean, thinking digestively too, that could cause that, but people with overactive pelvic floor can often have that.
Yes. Then let's just talk about urination too. So if you have the start and stop urination, or you're having to strain to empty your bladder, your muscles that wrap around, I happen to have a little balloon here. So here's the bladder, and here's the urethra where the urine comes out, and the pelvic floor wraps around there. And so if those muscles are overactive and not relaxing, then that can cause difficulty with urination too.
Yes, so exactly.
Good. All right. So what are your 5 top tips for painful penetration?
Yes. So looking at just the spectrum of how can we make penetration less painful. The first one being that I think a lot of women are just not using enough lubrication. This isn't the answer, but it's one of the
one
puzzles.
Piece. Mm-hmm.
Yes, exactly. So I recommend 1 to 2 tablespoons.
Ooh,
at least.
That's a lot, isn't it?
Yes.
Let's get some goop.
Yes. You can put a towel down, but make a little bit more of a mess and just be a little bit more liberal with it, both on yourself and on your partner. Yep, exactly.
Good.
So that
I like
we can reduce friction. One thing I think a lot of pelvic PTs are recommending is that if you have any of those suspension droppers that come typically with some medications over the counter with baby Tylenol, save those. Yeah, load that thing up. Insert it so it goes up and into the vaginal vault.
Because if you only have it at the introitus or the entrance, it may not travel that far. It might get diluted by the time we need it up further, right?
Exactly. Yes.
Good. I like that.
Yes. And then number 2, warm up. So foreplay can be thought of as a warm-up, just like before a run, just like before any sort of workout. Even in yoga classes, we have a warm-up period. And most women, they need upwards of 40 minutes of touching and being close and preparing to get increased blood flow to the area, get the muscles to relax and soften a little bit. And it's much, much longer than most men. Most men, they have a visual sign that they're ready. Women don't. So sometimes just taking it a little bit slower and allowing the muscles to be fully prepared. And there is an increased blood flow to the area, just like you would with the warm up before a run. So these are muscles just like everywhere else. So we want to make sure they're ready for physical activity.
I love it. And that foreplay is also just going to, if you have anxiety about because maybe you've had painful penetration in the past, right? And if you have anxiety, then that's going to also help to decrease some of that.
Yes, exactly. Good. It gives you some time to get emotionally ready and mentally ready.
And you're transitioning from doing everything that you just did throughout all the day and multitasking. Okay, I'm ready.
Yeah, now I'm.
But I'm not really ready.
Yes, exactly. It's preparing. And then third tip is to visit a pelvic rehabilitation specialist. There are physical therapists and occupational therapists that are just really ready to help and are trained in how to have these conversations and to tailor a unique program to help people that are having pain with intercourse. And then fourth tip is to address soft tissue restrictions that may be contributing to the pain. And that could be dilators, it could be a wand, and those are some of the things that we specialize in. I came to pelvic health from being a pain patient myself. And so one of the things that we have is dilators.
Good. You have some demonstrations.
Yeah.
Yes, I was hoping you would.
So this is the small set. So you can see here, this is the smallest dilator. And my intention was to make them really bright and cheery and pretty and fun. They're really soft, and you can see that the small one here is about the size of my pinky. They slowly and progressively get larger to accommodate wherever your goals are. And goals being, maybe it's the size of your partner, or maybe it's being able to have a medical exam or use a tampon. But, if your partner is this big and that's all the big you need to be able to accommodate, then you can stop here. There's no need to go to the end. But dilators are used to help train the brain and the pelvic floor muscles to be able to relax and open and be able to accommodate. So it's not just about stretching. It's not just about changing tissue and putting on lubricant on the dilator and putting it in there. It's about training your brain as to how to open and respond while using something in a controlled environment.
Yes. And so you have some demonstrations on how to use dilators on your website and YouTube. Okay.
Yes, exactly.
And it's intimaterose.com.
Yes. I have all different kinds of training platforms and guides and videos and things. So
yes, good.
People can search there. And then also for tender points deep within the pelvic floor, wands, this is our original one. It's still, and then this is our brand new one that vibrates. So vibration associated with increased blood flow and relaxation of the pelvic floor, so that you can come in and do some self-release similar to what we do as physical therapists manually, and being able to empower people to be able to do that on their own and at home. So different hooks to get into deep obturator internus, puborectalis.
Yeah. So just kind of, here's the pelvis, you guys. And if we were wanting to get into this muscle right there, you're not going to be able to reach that too well, especially on your own. So having that curved hook, so you're inserting it and it curves around.
Yes, that's exactly it. Yes. So addressing soft tissue restrictions. And then my fifth tip is to always be aware of the role that our bodies and our minds and our spirits play, and potentially investigating bringing another professional on board, whether it's a couples therapist or a sex therapist. And within counseling and within therapy, there's so many different avenues. You know, it could be talk therapy, and it could be more cognitive behavioral, where you're just retraining your brain as to how to think of things. And that's especially a good step to take if you've had a history of trauma or abuse, especially sexual trauma, but not necessarily. I mean, I see patients all the time, and one thing that softens my heart is people that, you know, maybe they had a traumatic birth, something that just really took them by surprise, and it's not associated, you know, there's no danger aspect of their partner. Yeah, but it was so traumatic that it's changed their relationship with their body, and that's affecting their sexual health. So, you know, trauma is trauma, whether it was an outright rape or all of these different ways that it can affect us. So EMDR, use of eye movement therapy, and some of these others, I have seen such beautiful results with some of my patients, just in their ability to do their daily life too, and with sex. So I always like to put that out there. I think it's becoming more talked about, but, you know, some people think like, oh, therapy, taboo, you know, but physical therapy and mental therapy and spiritual therapy, like, we all go
our
together.
Mind and body are connected.
Yeah.
We're one.
Yeah.
So we do like to compartmentalize, definitely. Yeah. But yeah, we're connected. And to say that your mind doesn't affect your body is just not true.
Yeah.
So,
no. Yeah. The
very
body keeps score.
Yes. Very good. Very good. Yeah. Okay, so we talked a little bit about the resources that you offer, but do you want to elaborate a little bit more about where people can find them and navigate your website and anything you want to share?
Absolutely. So on our website, on the header, there's one of the first things you'll see is guides and resources. And under that, there's like 5 or 6 other different subcategories. So you can get just a basic guide on how to use a dilator, how to use a wand. You can also go to videos and search by diagnosis, including pain with sex or urinary incontinence. And I've got over 100 different videos on those under that video heading. Yeah, you're catching up with me.
That I'm like, oh my word, that took you a long time to do all that.
Yeah, years and years. And I'm always looking for new ideas. So if you have something, you can email us at support, or you can contact me here on Instagram. I make custom videos all the time. I love, you know, somebody came to me the other day and said, you don't have anything here on IC. I'm going to make a video on IC.
I love it. Yes. Because if you have the question, somebody else has the question.
Definitely. Definitely. And there's no such thing as a dumb question.
Absolutely.
Yeah.
I love your spirit.
Oh, well, I love yours. It's a match.
Yes. Okay. So yes, so go to your website, and you can also purchase. Can you purchase the wands on Amazon as well? Because I know you can purchase the dilators.
Yes, exactly.
Okay.
Our wands, everything is for sale on our website, and then everything that we have is also available on Amazon if you like that. From our website, we do discreet shipping in 2 days, so it does mirror Amazon, but we totally respect and understand that some people just love that Prime and they want to throw in their, you know, meat bars and whatever else, batteries, those new ads for Amazon, headphones, all of
everything
that.
In one. Yeah, it's
exactly.
So easy.
Exactly. So, but if you do have concerns around somebody else possibly opening it, our packages are discreet, and there's nothing about the brand on the out.
That is good to know. Very good to know. So when might someone need to see a medical provider first versus starting a self-guided program? If they're wanting to, let's say they don't have access to a pelvic therapist, or maybe they just don't have financial resources to be able to connect, whatever reason.
Yes, all of the above, everything that you just said. So if it's new pain, if it's like something that is new, we always want to recommend you see your primary care or OB-GYN or Urogyn first, because we want to rule out any other causes of that pelvic pain, and we want to make sure it's musculoskeletal in structure and not something else. And then if you can't see a pelvic physical therapist, maybe there's not one close enough, or insurances, your deductible is quite high. That's why we have all of the guides and the resources, and I'm always here to answer questions and to provide that support. So Yeah, we've tried to make it so that those people have, I'm that person.
Good. So if you're having new pain, or maybe it's also like if you're having other symptoms too, like if you're having night sweats or, you know, like any signs or symptoms of cancer or these bad things, get into a medical provider. Try not to just treat it yourself. But
exactly.
But in your guides, I know, and on your website, you also are very much about safety first. So that's excellent.
Exactly. If the pain is not changing with position changes or time of day or something, we want you to be getting worked up, imaging and blood work and stuff like that.
Yeah, make sure. And then once all that is ruled out, then have at it.
Yeah, exactly. Yeah, let's get to work.
All right. So then what are some things to avoid with vaginal dilators? I'm sure you've seen and heard some interesting things. Give us some stories, Amanda.
Yes, this has been so enlightening because because every person enters instructions with a different lens, and sometimes you know they read steps 1 and 2, but not the rest. So we want to avoid prolonged pressure on our tissue. So whether it's with the dilator or with the wand. When you find, say, a tender point, if you're working with the dilator or working with the wand, we want to be respectful of that tissue. We're only going to compress as hard as we would to check a tomato for ripeness. So
I love that tip.
Yeah. Tomato touch.
Yeah.
Don't burst your tomato. So we're going to hold that pressure, and we're not going to hold it longer than 1 to 2 minutes. That's a lot of studies surround this 1 to 2 minute notion. And so we want to uphold that because there are nerves in there and there are blood vessels, and compressing them for too long can be detrimental. So not holding it any longer than that. And another thing along that line, if you are self-treating and you find a trigger point in your pelvic floor, move your leg and find a location where even though you're still holding pressure, the pain goes away. If you can't find any pressure that's like making this change, this tender point, it's possible that you're on just a nerve.
And that would hurt.
It would hurt, and it would make that nerve
And it's not going to make it better to keep pressing it.
Exactly. So keep that in mind as you're going through. If it's zinging and burning and will not change regardless of however you flex your hip, move your knee, rotate, try coming just 1 to 2 centimeters to the side. It should feel squishy and compressible. And even though it still hurts, tender points hurt, it shouldn't have that fiery zing to it, indicating that you're right on a nerve.
Good. Yeah. Okay, what about just jamming it in? Do we like that concept?
No, we want to be so tender with this tender part of our area. So one of the things that I like to have my patients do, so if we're working with a dilator and here's the vaginal opening, is if you're to the point where you're ready to be approaching the vagina, is to bring it to the surface. Inhale, relax, exhale, relax. And on the inhale, just gently try to drop and relax the pelvic floor and approach. And we want to go in ever so slowly, because there's a chance that the pelvic floor muscles will say, no, and they will clamp down involuntarily. You're not meaning to, but it happens. Yeah. And we want to give that a moment to relax before we proceed through.
And keep breathing.
Yes. Mm-hmm. Lots of lubricant. 1 to 2 tablespoons.
Lots of lubricant. Good.
Yeah.
And all of those directions are on your website and in the packaging.
Yes.
And
at the
you're
bottom.
accessible.
Mm-hmm, exactly. Always available. The instructions, so it comes looking like this. Usually there's a card on top pointing to where support is and where I am. And then the instructions should be there, or just located right underneath it with a nice bag to conceal it if you're traveling, and then boom, there's the instructions just right under there.
Excellent. Excellent. Yeah. Good. Very nice resources. Okay. And then anything different to avoid with a pelvic wand? What would you say, I'm kind of throwing this at you, about pregnancy and dilators or a pelvic wand?
Yes, it is always going to be necessary to clear that with your pregnancy provider. Yeah, whether it's a certified nurse midwife or an OB-GYN, is every cervix is different during each and every pregnancy, and we want to make sure that cervix is really healthy. They call it competent, like cervical competence. I hate that. It's like, I had an incompetent cervix, and it makes you feel bad.
It makes you feel kind of dumb, like, right? Like I'm incompetent.
Can't even grow a good cervix. But in that case, having something bonk up against it could be very harmful to mom
Yeah,
and
and
baby.
we need it to stay closed and competent.
Competent and closed for 9 months, and then we need it to just blossom open.
Then just open, yes. So we don't want to be jamming anything in there to possibly disrupt that. So check with the birth provider. And do you have any videos or any written resources on tips for if the birth provider said yes? I don't know that they would, but you know, it's a possibility.
It's,
maybe just shallow entrance, like we're working more, you know, in terms of working really deep, you're just going to do more at the entrance.
Yeah,
if your birth provider cleared it.
Yeah, and I do not have that video, and I'm writing that down.
Hey, okay, good. Yes. I love it because there's a really, you know, perineal massage, like, and we want to down train the pelvic floor. We want to teach the pelvic floor to relax so that when you're pushing, and this I could see a lot of potential here as a tool used correctly.
Correctly,
you know.
Absolutely, especially at the perineum, like you just said, and especially maybe with the vibration, just to get, you know, here's the vaginal opening. We're just gently working on opening it. A lot of, you know, practitioners are having people come through with their thumbs and do gentle stretching. So this adds extra extension over baby. So.
Right. Yeah, because how long is your arm? And how big is your baby? So, yep, that's the issue.
Yeah.
All right, good. Well, this is very, very helpful. Is there anything else that you would like to share? Maybe this might make a good gift for someone. The holidays coming up. What are some of your ideas there?
Yeah, exactly. It could make a really great gift if you know somebody that's suffering. It's oftentimes I've heard some of the people that have won some giveaways or gotten it as a gift, like, I never would have bought those for myself, and I'm really just thankful. So if you know somebody that's suffering, it's kind of an intimate thing, but it's a nice gift. Or looking at if your New Year's resolutions surround like better self-care and meeting some goals that you have, like buy it for yourself, you know, it's just one of those things. It was really interesting, you know, sex educators and sex therapists and medical specialists in the sexual health realm have always said that this goes from being a therapeutic tool to being then something for recreational purposes.
Self-care.
Yes. So because of the vibration component, you know, when you get to a healthy place, it could be used for other things.
Yeah, that could feel pretty nice, couldn't it?
Yeah. Yes. And we also have our handle. So if you already have dilators, maybe your gift for yourself is, Janice, I did it again.
It's okay. By the way, I know you're feeling bad, but I'll just have to out myself here about CSM. So last year in February, Amanda had a speech, and we were at a big physical therapy conference, and she said, could you watch my booth for a couple hours and, you know, talk to people when they come by? And I'm like, sure. And so they had all of their beautiful things, and they had just released the pelvic wand, and I think you had 2 on the table.
That we own, period.
Okay. Yeah. And so I'm talking to people, and one of them walked off. And I kind of still think I know who it was, but you know, I turned around and it was gone. And you have groups of people talking, and I just felt awful. And Amanda and Aaron were so loving and kind, and I still feel bad about it. But
no, don't.
We are sisters, and we're all human.
Yes.
I so appreciated your gracious spirits. And then the year before, how helpful you guys were with helping us set up our booth. That was our very first event of anything, and just amazing. So I feel a forever bond with you.
Oh, we are bonded, and it is overwhelming. Like, there was no part of me, like, I felt bad for you. You were doing me a favor while I was giving a speech. Like, you were holding it down, and it is overwhelming. Physical therapists are amazing, but there's something about an exhibit hall that makes people behave in totally unique ways.
It was just so disappointing. But anyways, okay. So we were talking about the handheld.
Oh, yes.
Yes. Okay.
A brand new handle. So if you already own dilators, maybe your new gift to yourself is the handle, which allows people. So it comes with silicone.
Will you show it how? So you insert it on top. And what's that long purple thing?
That is the handle itself.
Okay. So the blue and the blue or the green. Okay. I'll just let you demonstrate.
Sure. So dilator. So I picked our number 3 dilator here, our sweet little blue dilator. Silicone band. So turquoise goes with 1 through 4. Pink goes with 3 through 6. And big orange goes through the large set, which is going to be 5, 6, 7, 8. Or I'm sorry, yes, 5, 6, 7, 8. Yes,
Okay.
the larger one. So I'll demonstrate with turquoise here. So you just insert it into the silicone band, right, like so, and then you attach it onto the dilator base, which I'm going to stabilize here because I don't want to pull my flash down. There's been a couple of times people have been like, it looks hard to get on. Well, it's because I'm always yakking and putting it on.
Gotta focus.
So it's actually easier to put on than I make it look.
And with anything, it gets easier the more you do it. So.
Exactly. So it's a really flexible band. So if you're saying Amanda stumbles a lot with this, it's because it's mouth and hand coordination. But you can see here. So here's the top view. So it's stabilized on the base.
Pretty.
Isn't it fun? I used to design book. I'm scientist by nature, but this has been so fun looking at just colors that are really friendly and therapeutic. So it's attached here, and this gives you extra extension, extra dexterity, a little bit extra leverage. Some people either A, can't reach because of just how their body is built, or B, maybe they just emotionally need a little distance from their body while they're learning and going through this process, and they don't want to be right there quite yet. But that's the handle.
And sometimes this could also be used rectally, and so that's a little more difficult to access too. Yeah. So
side lying, and gives you that extra reach. So rotating through the back can feel funky sometimes. So good. Exactly.
Beautiful. And so that handle is on your website?
It's on our website, yes. Okay. And it should be on Amazon. It's brand new to us. So it's been on our website for a few weeks. Should be loaded onto Amazon. Amazon's a little bit different. So we have to go through a process, but it should be up.
Is it a kit where all the different bases come with the handle? Okay.
Yeah, so it comes with the handle, and in this place you'll find all 3 bands, so it all comes together.
Okay,
and it fits other dilators on the market, so if you
have another dilator.
Yeah, exactly. This will accommodate that, and we're happy to help.
As long as it has a base. So some of them, some of them don't, and then it would just slide.
Yep,
nothing to grab onto. Yep.
Yeah.
Okay, good. Excellent. Well, that was super helpful. Who are some people? Well, we talked a little bit about that, about who are some people that you might want to purchase this gift for.
Yes.
So pelvic pain, or maybe even a newlywed or a new mom. I mean, who wouldn't benefit from a little bit of self-care?
Exactly. Something interesting I've been exploring with another therapist, and there'll be more to come, is there is a population of women and couples that for spiritual reasons have never been together, and they have waited until marriage. So for a newlywed, not making it as like a joke or like a sex toy, but as a way of that woman be able to prepare her body for a new activity that it's never done. So we're going to be creating some educational content.
I love that because, you think, or the thought is it'll just magically happen.
It works.
And a lot of times it doesn't just magically happen.
No.
So our bodies need preparation, and the message here is that there's hope and help, and if you're experiencing pain or issues, we have some solutions for you. And you've spent a lot of time and energy on this, and I thank you so much.
Oh, I'm so thankful to you for all of the work that you've done. It's beautiful.
You also have some nice vaginal weights as well. So we didn't discuss that today, but that's nice for up training. So if we want to strengthen the pelvic floor. See, I almost lost my phone. You can't see it, but I was using my hands. So, so anyways, you have a lot of nice options. Go to intimaterose.com, check out their video resources, check out the product resources, and have a great Christmas.
Yes.
And treat yourself or treat someone near you.
Exactly.
Yes. And I will be seeing you in February in Denver. Yes.
And I went to PT school in Denver, so it's a very special place to me. So I can't wait to see you. And Denver is so special.
I love it. I love it. So it's going to be a fun one. Yeah, we will. All right. Well, thank you everybody for joining. Have a great day. And thanks again, Dr. Olson with Intimate Rose.
Thank you.
All right. Take care. Bye-bye.
Bye.